Hi, today we have with us Dr. Kavita Khanna, who's going to tell us about her journey from doing BDS in India to getting into DDS in Canada. Dr. Kavita Khanna completed her BDS from CCS University in 2010 and is currently doing her DDS in Western University in Canada. Between this duration, she has worked a lot and achieved a lot. She was managing two dental practices in Delhi. Other than that, she was also attached with a chain of clinics which was associated with the CGHS program. She was also working as a research associate in pharmacovigilance for a pharmaceutical company. Other than that, she was working in the insurance sector as an educator. In 2019, she, along with her child and husband, shifted to Canada. There, she was working in a dental clinic. Also, she was working in the insurance sector as a health and dental educator. Other than that, she cleared her first two licensure exams and then got into DDS program in the Western University. I'm Dr. Satish Kumar. This is Kaizen Dental. Our aim here is to help dentists succeed. Hi, Dr. Kavita. Thank you for taking your time and joining us. We all know getting to Canada and getting clinical dentistry out there is extremely difficult, and you have got straight into DDS. So, my first question to you is, weren't you afraid of the entire process? And if so, did you think of getting into the non clinical options? Or you were always clear, I want to go to Canada and practice dentistry? What was your frame of mind?
Mhm. First of all, thank you so much, Dr. Satish, for having me here. And to be frankly speaking, yes, it is difficult. And I was really prepared that it's gonna be difficult. And for that reason, I was sure that I'm gonna go and earn first and then get into the process because living expenses here, starting and starting your life from the scratch, it's not easy. So I looked for the non-clinical option, and in fact, I started working in an insurance company just because for the same reason that I'm gonna go to Canada and work there. So I knew that insurance industry was a big boom at that time also, and it currently also. So I started working in an insurance company in India as we were applying for the Canada process, and I gained my experience there. And I don't even remember how many jobs did I apply before landing and after landing as well. I don't have the number, to be very frank. And because of that reason, I started building contacts on LinkedIn as well to get into non-clinical field first so that I would have a job in my hand to take that difficult and financially draining route for getting into dentistry. So I was looking for the health and claims dental adjudicator job at that very time. And luckily, I got into one of the leading insurance company first here. And along with that, I got into a clinical field as well. I was working as a receptionist and a dental assistant in a dental clinic. That job
Okay.
I got 20 days after landing. And
Okay.
after a few days, my interviews were going on for my non-clinical fields as well. And then I got into claims administration, not into the health claims department as I wished for, but I got into claims administration in one of the leading industry, like insurance company here, was Intact Insurance. And I landed up working 7 days a week. I
Oh,
was working
7 days
from
a
Monday.
week?
Yes. So I was working Monday to Friday in that insurance company as a claim administrator, and on Saturday, Sundays I was working in clinic as I wanted that experience as well. So then, this was my backup plan to survive here, and I looked for all the non-clinical options, and I knew that this dental insurance is a big boom and would help me in getting into dentistry as well. And firstly, I got into claim administration. Then I left that job, quit that job just because for the exams, like 3 months before my first exam. And then I started going again to the clinic. And then I fortunately got during COVID times when it was a lockdown and all. Then I got into the job I applied 1 year back, and that was into dental and health claims adjudicator in IA Financial. And it was one I was looking for. And along with that, I applied for my second exam, and I took that exam along with working in that field. So yes,
Understood.
that
So
was
you
my
were
backup.
juggling a lot of things and you knew your
Yes.
backups as well. My point is it easy to get into the insurance sector out there, or just because you had a good experience in India, it was helpful?
Uh, it helped me, but it's not easy, I would say, because it took me also like almost a half 1.5 year to get into the stream I wanted. But I got into insurance company within a month. I mean, I
Understood.
got into it, so I would say it's easy, but depends. Like, yes, it depends. The experience you have and how you perform in the interviews. There are so many rounds of interviews they take. So it really depends. But yes, if you have a good resume and you have a good experience, I think it would help.
Understood.
And they look for people from the healthcare industry in those streams. It really depends what kind of job you're applying for and you have made your mind for that or not.
Got it.
So yeah.
You told me that simultaneously you cleared your part 1 and part 2 exam for the licensure process, okay? And
Mhm.
then you got into DDS. Now we all know for getting into DDS, just the first exam is enough, okay? And if you want to get a license after the second exam, just give one more third exam and straight you can practice. Why did you give two exams and then get the DDS route where you have to study for further 2 years? Why did you do that?
Um, so both the routes are equally good, and as I like to juggle things, and I like to have both the safe options in my hand. So that's how I started applying for both the routes. And yes, I had inclination towards the DDS route more, but again, I didn't want to stuck to one thing, and that's why I applied for both the routes and then went for the DDS because I got it. And like I know, like it's difficult for the people who are coming here with family, and you cannot get stuck on one thing that I just want this thing and I cannot accept the other thing because life has to move on. So that was my plan, and it's really subjective. Some people really want to get into school only, some really want to get it for the licensing. Both routes have their own advantages and disadvantages, but I wanted to open, like keep both the routes open for me, and the DDS one had more inclination towards that, but that worked for me, so I took that. And it
Oh,
was
that's
also
a
the
very good
COVID
advice.
times. Yeah. And I would give this advice to everybody, like who is coming and planning here. Yeah, like keep the both routes open. It's really competitive. It's not easy to get into a school, and it's neither easy to crack those exams.
So
For
whichever you
me,
get first, you
luckily,
should take it.
exactly. Like the condition here is like beggars are not choosers. If you want to get
Understood.
into dentistry, it's like you have to keep it open so that whatever comes your way, you just go ahead. You don't want to waste your time like here. It's really important.
Understood. So you should just
Mhm.
go on with it, and whatever you get first, just grab it with both hands, basically.
That was my approach. Some people want only DDS, some only wants to go through licensing. Like it's draining. Like DDS is like financially, if you say like fees are really, really high. But if you say the licensing process, if you're not clearing exam in a single go, then again it's also becoming expensive.
Understood.
So it's really subjective, but both the routes are equally good. It's your choice. Yeah.
Got it. So what was the DDS process? You gave your first exam, then you apply to these colleges, then what happens next?
So different universities have different criterias. Like few have bench exams and then interview process. You fill in the application form that appear for the bench exam. Like for the Western University I am in, you first apply for the PLA course. They have a PLA course, like it's prior learning assessment course, and then you appear for the bench exam. Then they shortlist people, and then there is an interview you have to go through. And a few universities have Casper test, few universities have bench exams, judgment exams, like Alberta, University of Alberta, they have this judgment exam before, like an interview only. They earlier they were taking bench test as well, now they have stopped taking. So every university has different criteria. Now University of Toronto, they are taking ADAT exam, DAT scores, they're not considering the first exam we are taking for the licensing route, like AFK, if you're aware of,
Yes.
assessment of understanding. They have stopped considering those scores now. So this is really changing nowadays, and it's really dynamic. Like, so
Understood.
for yeah, so
So should
for my
we
university.
so should we go to specific university websites to find this out, or is there a single portal where everything is given?
No, each university, you have to visit university websites where you would find the requirements for each university. There's no portal, like common portal where you can find for the requirements of universities. Yes, it's a big thing. You have to be proactive because sometimes deadlines just go by like that. You don't even realize that you have missed those deadlines of even filing an application for IELTS score. They have so many requirements they need. Sometimes they need few documents from your back home, like from your universities. Different universities have different requirements for the DDS plan. Yeah.
Got it. So what was your process? You had an interview and a bench test, or only one of them?
Yes, I had bench test and then interview
So how
for
did
my
you prepare
university.
for the bench test? How was it, and how was the interview?
So for me, again, I was working at that time, and I joined a coaching institute because you need guidance for sure, and you lose track after coming here. You are not in touch with dentistry anymore, and I joined an institute, and I used to go there for a good amount of time. Like in the evening, I used to go for around 4 5 hours, but it's really competitive, and I would suggest, like, people were, when I used to go after my office hours. I was working at that time, but people used to study, like, practice there. They were practicing there since long, like, so people are really proactive and really competitive. So I was practicing after my interview, after my office
Office hours.
hours. Yes, and then for interview also, I took guidance from the coaching institute here. You need to know what kind of interviews are those. Different universities again have different things. So I took guidance from one or two institutes, and luckily I landed there, and it helped.
How was the interview? Was it tough, or what were the questions they usually asked towards?
Interviews, like, uh, tough or easy is again subjective. Like, I appeared for so many interviews when I landed to Canada. Like, I appeared for so many interviews for my corporate jobs early. So I didn't find it really tough, I would say. I mean, it's a normal interview. They look for a few things in a candidate. For my admission to the school, I joined an institute. I used to go after my office hours. I practiced there. And for interview also, I took guidance from two of the institutes. They guided me how to go for the interview. And also, your other interview experiences help in this process. I had so many Canadian interviews when I landed here for my job. So I think everything matters, and holistically, everything helps you get into that.
Understood. It's basically you need to know how to answer, and they should
Yes,
understand you as an individual, basically. So if you've given
exactly,
prior
exactly.
interviews, like in your
People,
case, you are more confident.
you can say so. And I would say that they are so experienced. People with white hair are sitting there to judge you. So, like, you have to be truthful, you have to be confident, and they can just get those vibes, and they can just, guess who is where.
Understood.
So, it's like that. Yes.
Got that. So how much does the entire process cost, basically? I'm sure you're enjoying this conversation. So before you listen to the answer to that question, please do not forget to hit the like button below. And if you're planning to take your career to the next level after BDS, this is a channel you should subscribe to.
So, cost is really high. And like, starting from the NDB application, I would say it's around $800 to $1,000 when you file in your application. And then for taking those exams, starting from first exam, the exam fee is around $800. It keeps on changing. I believe it was 800 when I took my exam. And then for second exam, around $1,200 or $1,300. And third exam again is really expensive, $10,000. This is
Understood.
just the fees you have to give to NDEB to appear into exam. Like
Understood.
along with that, the coaching fees they are all separate. Like starting from $3,000 to $4,000 per exam for first AFK and ACJ, the clinical exam. And for third one, it is like crossing limits. It's like $6,700 to $7,000 and increasing day by day. So for this process, it's really expensive. And if you're applying to university, again, it ranges from the application fees. Like it ranges from $300, sometimes $200 for each application. And few universities, after they consider your application, then for the interview process only, they charge you around $1,000 to $1,500 for appearing in the interview or the exam. So it's really expensive.
And how much is the course fees approximately in various universities there?
DDS course fees?
Yes.
It is also variable for each university, but again, it ranges from I would say 150K to 10. Something
Okay,
like
that's
that.
per annum into 2 years.
No, this is for the whole course.
Okay, for the entire course. Understood.
Yes.
So you get loans for all these processes?
Yes, we do get loans. Without that, there is no survival because you cannot work alone. And like one of the bank here, they are providing line of credit, I would say, line of credit for appearing into the exams, appearing for your licensing exams. Like for first exam, they offer around $25,000 for the AFK, and then when you clear that, they want the proof that you cleared that exam and you have registered for the next exam. They want that proof. And after providing them that proof, they give you around 10,000. Sorry, for the second, they give you around 15,000, I believe. I'm getting wrong with the numbers, I believe, but in total,
Understood.
they provide
So basically give you a line of credit
100K.
so that
Yes.
Good.
100K they provide you for the whole licensing process. Like at each step, after you clear the exam, you get the money, like 25,000 for the first, then 15,000, then again 50,000, and then appearing into the boards, they give you around 10,000 again. So in total, they will provide you around 100K.
Understood.
And if you have got admission, if you have got admission into DDS and you have that admission letter offer letter in your hand, then you can get around, they provide you 350,000.
Okay. So everything is taken care of, but eventually you'll have to pay it.
Yes, obviously. Nothing for free. You have to pay. Yes, the interest
Any
rates
difficulties you faced with the entire process or with a loan or anything of that sort?
No, it's not that difficult if you have a good documentation in hand. And yes, interest rates are there. Like it was quite low before. As compared to India, if you would say that, then it's really, really low. But now the interest rates have gone high. So it was low, very low before. It was 1.6 or something like that, 1.6%. But now they have come up to by 5 to 6%. They are like, yeah, there is a hike in that.
So how is the education system there different from India? Because you've been doing DDS right there now. You've done your BDS in India. So what was the difference you've seen in both the education systems?
I'd say there's a lot of difference. I mean, if you compare for the dental schools there, we are getting a comprehensive patient here. So as you know, where there we used to get into each department. Like we have posting in endo, we are doing endo for few months, few days, and we are posted in operative. We are just doing restorations for few days. It doesn't work like that. We are allotted comprehensive patients here, and starting from that treatment plan, like that patient is just given to you, and you have to take care of everything. So you don't only learn about a single procedure. You learn how to communicate, how to manage patient, how to call them. You have to call them as well in the school. So I mean, everything is being taken care by the student only. So you learn to treat patient as a whole in a comprehensive manner. So this is the major difference that I saw. And other than that, there are many things like different from our school, like the way they work, the protocols. There are the protocols they follow. There are so many things, new things to learn on. No doubt, I'm building on what I learned from my country. I'm building on that. That was my foundation, but there are so many new things to learn on, and that's keeping me moving. It's good to learn new things here. Yeah.
So, what's your advice if someone is planning to take the journey you've taken? Go there, try non-clinical, work, try getting into DDS or through the licensure process. What is your advice to someone who's thinking of Canada as an option?
Um, my advice, like it really depends on your background, like the person who is coming and what they want. It really depends on that. I mean, few people here, they just get into exams, they want to clear those exams and don't even work. So it really depends on you, like what your background is, how much you can afford here. Things are really subjective. But few things I would like to advise are like being proactive is the key, and prioritizing things. Like so many things bombard here together. So one should know how to prioritize things, and time management like is required a lot for preparing for starting building things from scratch. So these few things you should keep in your mind, your finances and how you want to study. Like there are so many things that would come along. So making your mind clear of the struggle there's gonna be, and preparing yourself for the good things ahead. Keeping positivity in your mind would help sailing through this difficult process. But pre-planning everything is the key, like how to plan for the things. And I would say keeping your second option open would give you confidence and courage to move forward, because I've seen people getting mental breakdowns that life is ending. Like if you don't get into this, life is ending. Like everybody has their own perspective and everybody has their own things to do, but I would say keeping a backup option is always better to give you confidence to move forward, and prioritizing what you need in your life. So that would help.
Understood. That's really good advice out there. So people should pre-plan. They should know their situation, study,
So,
and learn how to manage other things if they are planning to work and simultaneously. Uh, so that's
exactly.
so that's a very good advice you've given out there.
Thank you so much.
So
I
Dr.
hope
Kavit,
this advice would work for people planning to move
yes,
here.
100%. I'm sure they've got a lot of good advice from it. They would understand a lot of things from your journey. And you're always approachable on your Instagram page, Dr. Kavita Khanna. We'll be
Oh
putting
yes.
your details of your Instagram page or on Instagram page. So anyone who has doubts, you can contact her. She's extremely helpful.
Yes,
Thank you for
I
your
would be
time.
happy to help. Thank you so much.
If you like this video, I'm sure you're going to like our video with Dr. Chaitanya, in which he discusses his journey of getting into Canada after BDS and MDS in India. I'm Dr. Satish Kumar. This is Kaizen Dental. Our aim here is to help dentists succeed.